Well, we are at the Red Cross Center, Rastabed, Pune, once again with Dr. Vijay Ramanan. We've already done an episode on thalassemia the last time. Dr. Vijay Ramanan is a well-known clinical hematologist and has done hundreds and hundreds of bone marrow transplant. We are here today at the Red Cross Center, which now is called the MVR or IRCS MVR Welfare Thalassemia Daycare, which is run by Dr. Vijay Ramanan. He heads the association. This particular center has been working on thalassemia and has been giving free blood transfusions to at least 150 children every month. And each blood transfusion costs about 15,000. The center has also built a school and has been educating the underprivileged students for years now. And these underprivileged students are now working elsewhere with great confidence, self-esteem, and emotional security. And each student, the cost of the education is 25,000. We are here today to talk about thalassemia and food. But before that, I would entreat all of you that since this is an independent association, although associated to the National Red Cross, if you can donate, it would be very much welcome because it takes a lot to look after these children. As I said, it's 15,000 rupees per transfusion, and they look after 150 thalassemia patients every month, giving them free blood transfusion. We are here today to talk about thalassemia and food. We would like Dr. Vijay Ramanan to let us know what is it that patients with thalassemia can eat, what is it that they should not eat. Doctor, if you could educate us on the kinds of food that a patient with thalassemia can eat.
I would like to add one small fact.
Yes.
This number you said over 15,000 is not for transfusion. It is for everything else they need in their whole month.
All right. Okay.
So investigations, travel, and the drugs they need to remove the iron.
Okay.
This is not our figure. It's a figure from Government of India, which they said around 2 to 3 lakhs per year is needed by every thalassemic. So if people are able, somebody helps up with even 15,000 per year, that's more than enough.
Yes.
So per patient.
Yes.
That will be our request. So now coming to the important question of the diet. People have to remember thalassemia is a genetic disorder. What I found in many patients is they try to eat iron-rich food. They'll have the dates, they'll have the anji, they'll have the raisins, and believe that the hemoglobin is going to go up. But remember, all these things will only increase your heme, but not your globin. So all problem with thalassemia is because the heme is very high and the globin is low. So if you increase more of heme, the disparity between them increases and you have more complications of iron overload.
Okay.
So our patients who are at the centers have been requested to stop eating too much iron-rich food, no iron utensils. If you're eating non-vegetarian food, no liver, no lesser of chicken, lesser of mutton. You can have white things like eggs and fish, and have black tea or black coffee with or without sugar, depending on your diabetic status, after food. So the iron which is there in the food will also not enter the circulation. Because the number one enemy of any thalassemia measure is iron.
Absolutely. Yes. Okay.
So it gets accumulated in the heart, in the liver, in the bone, and other organs as they grow older. So they are shorter in stature, they don't have features of sexual development. All those things happen beyond the age of 10 years.
Okay.
Problem with thalassemia is the first 10 years, you give transfusion, nothing is seen. So patients start believing, the parents start believing blood transfusion is the best thing. But after 10 years, when the iron starts accumulating, you have liver problems, you have heart problems, you have all other organ thyroid problems. All these things happen, and we have published a study. We have shown the bone strength is weakened by the age of 15 years.
Okay.
And usually our kids in India get fractures in the upper limb and the lower limb.
Okay.
And the thalassemics in European area seem to have fractures in the spine.
Oh,
Unknown
yeah.
has. So it's very important to remember that these all complications occur because of iron overload. So thinking that you eat iron and you'll get more hemoglobin is a wrong notion.
Okay.
It will drop your hemoglobin more.
All right.
More iron.
Okay.
You reduce iron intake, not from vegetables, but
No.
unveg sources. Do not use iron utensils. Have black coffee. These are the important things.
Okay. Couple of questions that have just risen in my mind that I would like to ask you, and then we'll go back to enumerating the kinds of food that one can eat. You talked about iron overload, and then it affecting the bones. So that means the bones have to get stronger. Now, for that, you need your calcium, you need vitamins, you need minerals,
Exercise.
exercise also. But coming back to the consuming, the supplements, I'm sure they would have to have supplements, right? Now, sometimes these supplements also have added iron. Now, would that not affect them? And if that is so, do you have special kinds of supplements for people with thalassemia?
See, calcium usually does not have iron because calcium and iron fight with each other and do not get absorbed.
Okay.
All the companies are selling calcium and vitamin D with some multivitamin assets. So those combinations are available.
Okay.
There are few vitamin combinations, vitamin preparations which have iron.
Okay.
So we advise all our patients, small or big or young and old, to look at the package. If there's iron mentioned in it, in fact, do not take the medication.
Okay.
And if a doctor has prescribed, please go and tell them also. There's because there are many times companies do not change the brand name but change the content, and doctor won't be aware about it. So that is very, very important. So if you see iron written on your health drink, on your marsh drink, or anything, please do not take it.
All right. And another question is that you said the liver gets affected. So there is an overload on the liver. And how can that be stopped? Or is there some kind of an alternative? Because blood transfusions also, a lot of blood transfusion can increase the iron content in the body.
Yes.
So is there some kind of an alternative or some medication that if that happens, how do you control it?
Yes, so we have 2-3 medications that are available in our country. One is called deferriprone. It's called Kelford. That's been available thanks to Cipla in this country. And it's at a very affordable price. The thing is, this drug removes iron from the heart. So
Okay.
on heart is iron overloaded, we would prefer this drug.
Okay.
There are 2 drugs, older drug, injectable drug called Desferal. It's got,
Okay.
but with all injections, you have to give it to yourself. It's a very difficult task
Okay.
because you have to give it at home. That's the ideal way of giving it. 5 days a week.
Okay.
You need to give at least 12 hours, 8 to 12 hours a day. So it's very difficult for an Indian patient to organize all this. There's a pump available which you can, kids connected to put the medicine into a pump, into a syringe, put it into the pump, and the pump is attached. And so when they sleep, they put it. So that's the way the West is doing it.
All right.
In India, what we have found out is when the patient comes here, we give through intravenous because we can put it through the way. But that's a bit less, but at least something is better than nothing. So
Okay.
Kesperal is the second medicine, which removes iron from the liver, from the heart, and takes it out through the kidney.
Okay.
Last is a drug which has been available for us 8, 9, 10 years, which is called Deferasirox. There are 2 preparations of it. So that removes iron from the liver and little bit from the heart. So these are 3 drugs which are available. The cost for Deferasirox per month is around 3,500 to 4,000 at least per patient. So that's why that's in the 15,000.
I was just going to ask you this question that over here, you give them free diagnostics, you give them free transfusion, free medication.
Free medication we have not been able to match for everyone.
For everyone.
Get it.
Okay.
So we need the funding so that we can give it to all the kids. We give the
Yes.
free medicines, get vitamins as well as the chelators. These are called iron chelators.
Here.
So chelation therapy can be given to our kids.
Hmm.
So that's what is my desire. Every kid should get full requirement of the iron chelation. Hopefully we'll get a fund after your.
I'm sure, and I hope, and I do request and entreat people who are watching this, if you can really extend yourself, in small way, just 1,000, 2,000, if this multitude can, give to this particular organization, you would be helping a lot of kids. Let me tell you, I'm here, and I have seen kids out there on the bed with their parents going through treatment, and it is heart-wrenching, believe me. So yes, I would request you, if you people can donate in small sums also, it will help them extensively. Coming back again to food, we've I would like for you to be more specific. Like there are certain grains that they can eat, they cannot eat. There are certain vegetables that have heavy iron content in them. Uh, so if you can enumerate some of that for us, so people are more aware. Like you said, they take a lot of prunes and raisins and dates, which have a lot of iron. So if you can be a little more specific, I would really like that.
See, we use a thing called beet grass, which is grass which grows when you sow wheat. So we have been using it. I've been using it for last 16, 17 years as a therapy in thalassemia. But leaving aside, besides that, I think you're trying because I've become more of a gluten
Free.
gluten-free guy.
Yeah.
So I advise all my patients to do the same. Maybe 60-70% of patients get benefited because of a gluten-free diet. So that's not the rule. There's no mention. I mean, there's no data available.
Okay.
But what we see is all the gastrointestinal symptoms reduce. Bloating and all those things reduce when they have a gluten-free diet.
Okay.
We don't know whether the gluten-free diet reduces the amount of iron which is getting accumulated also, or that will need a bigger study, and we don't have funds for doing the daily activity, so we need a fund for doing the study. So today we advise to be on millets, but there are few millets like ragi, which has little bit of iron. So that's always a concern. But I always tell my patients to have black tea or black coffee along with the
Meals.
along with meals or immediately after the meals. So that helps in reducing the iron from the vegetarian sources. So there's no problem in taking spinach and all those things. If you could take black tea, black coffee, that itself is a chelator. So that takes the iron away through your motion. So it's absorbed. So you get all the other nutrients, but except the iron.
Except the iron. So is it better for them to consume it whilst they're eating or, as you mentioned, after they have had their food?
Whatever is convenient.
Whatever's convenient. Okay.
Better to eat, drink and eat at the same time, but it's very difficult at times. They don't remember also. So they can have it 15, 20, up to 20, 15 to half an hour, 15 minutes to half an hour after food also. That should also do the job.
That will work.
Yes.
Okay. All right. I also read somewhere for them to increase their bone density, they can also consume 2 glasses of milk every day. But I have to ask a question. Today, everything has got chemicals in it. The vegetables, the fruits, even the milk, the cows are injected. Would this create any harm? Will this affect?
No, I really don't have data of it. But there is a gentleman named Donald Thomas. E Donald. I don't remember the full name. From Cornell University, who has published a book called The China Study.
Okay.
So that mentions about the side effects of milk on incidence of malignancy in China. So now that's a retrospective study. That is like after patients got cancer, then you go and study the diet. So it has got something called a tertiary bias. So there will be many people who criticize it. But what we are doing in our patients with malignancy, we are asking them to cut the amount of casein, which is a protein,
Yes.
milk, to be reduced in their diet. We have not done that with our thalassemic children. There's not, I would still continue with that glass of milk. It doesn't harm. In fact, the glass of milk will help me in chelating the iron also.
Oh.
So it won't harm, I said.
All right.
And calcium, there are supplements which are available. Other food sources also are available. Vegetarian sources include something like a sitafal, which has a lot of calcium in it.
Oh, I love sitafal.
Yes, and ragi also has calcium in it.
Uh-huh.
So those are the sources which we can focus on and give it to the patient. But what I feel is more than the calcium, it is the exercise which is very important. So if you consume protein and you don't do exercise, you not get muscles. It's not the protein which gets you the muscle, it's the exercise which gets you the muscle.
Okay.
Similarly, in the bone, if you take a calcium tablet, you do not go for a walk, the calcium will go through your urine because body needs a direction for it to be used. So believing that one tablet of calcium is going to either cause kidney stones or cause strong bones is wrong. You need to exercise, you need to do impact exercises, you need to walk every day or walk alternate day at least for the calcium to be absorbed into the bone. So that's very important for not only for thalassemics, even for
normal individuals. So you specified walk. What about strength training, with weights and
that's needed for everyone, not for only for thalassemics, everyone, because the muscle strength will only come with the strength training. Usually around 30 minutes alternate day is ideally needed. You need to lift whatever weights are available at home because that's free. You need not go to a gym to pick up something. And the strength training helps the bone also because once your muscles are strengthened, the bones also strengthen along with it.
Okay. What about these recent fads that have come out? You have a keto diet, you have intermittent fasting, you have a paleo diet, if I'm not mistaken, Mediterranean diet. I just want to know, doctor, since you know so much about food, how helpful are they?
See, it's very important to understand that the present generation for last 70 years has been overeating.
Overeating.
Overeating. We have been overeating. We have been sold food from probably post World War II. It happened. The whole epidemic happened in America till 1980s, 90s when the heart attack incidents went up. India is falling into the same trial. We are eating a lot because financially we are improving with GDP wise.
Yes.
So people are getting money. So when money comes in, people run behind tasty food.
Okay.
So I tell it's my grandfather's dialogue that if you eat something tasty, your life will not be tasty.
Oh my God. Okay.
So what I feel is what's important to remember is our ancestors used to work in the fields. We used to usually eat twice a day with more millets in it because they did not have sources where they would have tasty food. So that was not an option. So I've seen people live till 100 years because they had a very prudent diet, eat less, probably ate at 10:30 and 5:30. They do not have diabetes, blood pressure, heart attack, dementia, cancer, nothing, no malignancies. So they reduce malignancies. Now malignancies have gone up. A, because of the insecticides that we spray. B, because we're eating too much. Obesity has been clearly connected to malignancy, heart attack, blood pressure. You name the disease, it will be there.
Okay.
So it's very important for us to eat prudently. Or you want to follow keto diet, you want to follow paleo diet, whatever you want to follow. People will say standard diet should have more this much carbohydrate,
Yes, exactly.
this much fat. But remember, our ancestors never. I mean, if you know somebody who's lived 100 years, go and ask them. They will not follow all those rules. So in Maharashtra, they used to have something called kadadhanya, which are a combination of legumes and millets,
Yes.
and they would have fixed amount of it. So that was very important. I always give an example of Shivaji Maharaj having food only once a day, which was a sattu ki kachori. That's what I found a mention about.
Okay.
Which was usually cooked in til, sesame oil.
Sesame oil, yeah.
Today we do not know, Maharashtrian does not know sattu. It's called satu in Marathi. And probably sesame oil is only used when when someone passes away and to light up
To light up fire here.
yeah, fire and the lamp also. So I feel the sesame oil should make an entry back into the Maharashtrian diet. Along with that, we need to restrict or reduce the amount of food we eat per day. So our ancestors were anyway following intermittent fasting.
Yeah.
They were anyway doing
Now that you're telling me all of this.
yeah, now we have Americans making books out of it and telling us again, and we are getting fascinated by it. The truth is, the whole story of we should have the breakfast, the lunch, and the dinner, and everybody knows it. My grandfather used to say, "Ki eat your breakfast like a king, lunch like a normal man, and dinner like a beggar."
Yes.
So it took me some time to understand that the beggar doesn't eat anything. So what they probably meant is, do not eat your dinner, only eat your breakfast.
Breakfast and your lunch, yeah.
For me, it suits. I do not have my breakfast, and it keeps my weight in control. The day I have my lunch, breakfast, and my weight goes up.
Good there. Okay.
So I've decided I'll have my lunch and my dinner predominantly. I also make mistakes. I also do because I'm human.
Guess we all use more.
First steps reduce the number of mistakes that I'm making.
Oh, that's because you're so self-aware. You know, self-awareness is so important in this world, and at this point in time, especially.
Food food is, you have a infatuation for food. Everybody has it. So I also have for some things. But and think we should stop our relationship with food has to change. We have to take food as a fuel, not as a tool for enjoyment. And we can enjoy our exercise, enjoy our conversations Probably that will be better.
Absolutely. And some are read.
The Instagram reads.
And reading from books.
I read from books, yeah.
People have gone onto the Kindle and what else, I have no idea, which is also affecting you physically and mentally.
At least the light that comes out is better.
Yeah.
Because all of the lights which comes out of the mobile is blue light, which is suppressing your melatonin. Melatonin suppression reduces your sleep and increases the chances of cancer.
Absolutely.
So all things are related to our lifestyle.
So in our Vedas, they always say that, you got to eat before your sunset. It's within that.
You can try it on yourself. If you had a
Yes.
CGM, eat the same meal at 5:36 and eat the same meal at 8:39, or the sugar spikes will be different.
The metabolism, I think, slows down.
Metabolism slows down. A microbiome in the intestine probably starts behaving differently. Maybe they go to sleep and something else happens after that. We don't know it today.
So do you follow this kind of a method with your patients? That is, you eat before sunset. Would it help
I
them?
tell them everybody. I've in fact some of my parents of my patients and father and mother and even husbands of patients have heard taken my advice seriously.
Yeah.
Patient may not have taken it, but I've seen 2 or 3 patients who have got the blood pressure, the sugars going down,
Oh, brilliant.
and stopping the medicines. So it's very simple. So we have to eat less to be less ill.
Absolutely. So well taken. Coming back to food again, if you have any special advice to be given to our audience.
I would say, I mean, as I said, take food as a fuel. So today morning I was walking with my friend and he said, we can walk after we have some vada pav. So I said, would you fill a bad diesel in your car and then start running it? He said, no. So it's very simple. If you put a bad diesel in your car and start running it, you know that the engine will go off.
Absolutely.
But you don't remember when you eat a junk food and try to do the same thing, your engine, which is your heart, your liver, your other cells, immune system, that will all go off. So ultimately, you'll develop all the diseases you don't want you to develop. Everybody wants to live longer, a healthy life. Everybody wants to pass into the ages in a certain way rather than a slow way going to the hospital. And I think if we eat less, half our hospital population will reduce.
My mother actually was suffering from pancreatitis a few years ago at the age of 92, and we took her to this particular hospital that focuses on, the stomach ailments. And let me tell you, it was crowded. Everybody had this issue. So, doctor, thank you so much for your valuable time. Believe me, it is a challenge sometimes to get his time because his focus is his patients. And somehow we managed to get this time with him again. This time, the last time it was at the Ruby Hall Center. This time it is at the Red Cross Center, which is today called the IRCS MVR Welfare Thalassemia Day Care Center, which is run by Dr. Vijay Ramanan. He heads it and looks into the details of it. This particular center also has other facilities like opthal, dental, OPD, and many more. And scans also. Oh, wow. Okay. And all this is done for free, mind you. They also have
Concessional rates.
at a concessional. Okay, this is
For patients, but
okay.
at a concessional rate as
For the others.
all the other hospitals.
All right, all right. Okay. So, and as I mentioned earlier, 150 patients, thalassemia, are given blood transfusion for free. It will be my request again, if all of you who are watching this would contribute in small measures also, it would help them greatly. Doctor, thank you so much once again, and thank you so much for listening to us so patiently.
Thank you.
So we are at the IRCS MVR Thalassemia Daycare Center. We are here among the patients who are going through their free blood transfusion. And I'm here with one of them to understand her journey. How has it been ever since she was diagnosed with thalassemia? Her name is Shreya Chawla, and she's 20 years of age right now. So Shreya, could you tell us when is it that you were diagnosed with this particular disorder?
Yeah, I was 6 months old when I was first diagnosed with this disease. When there was not any awareness about thalassemia, I family didn't understand what happened. So then I had to take continuous transfusions. But when I came to Pune and my dad got to know about Dr. Vijay Ramanan, so we came here and we got to know that he is a hematologist and treats thalassemia patients. So we came here for him, and since 4 years I'm undergoing treatment under his treatment. So now I am fully off transfusions.
Oh, brilliant.
Yeah. Now I don't take any transfusions. In 2007, I underwent my spilectomy. So after that, I did not take any transfusions. And it is only because of Dr. Vijay Ramanan that I am so cured. I can say he's a god for patients like us. So I'm very thankful to him. Yeah. And because of him, I think I can live a normal life like other children. They cannot like I cannot, like people cannot tell that I'm suffering from very disease. And I'm living a very normal life. I'm studying. I'm basically now I'm pursuing my degree BSc in biotechnology. So I don't have any problems going on with my studies or anything related to it. I'm living a very normal life because of him, because of his treatment, because of his medicines, I can say.
Oh, wonderful. So, do you come here for regular checkups?
Yeah, but at doctor's clinic, yeah, every 6 months I take his appointment and visit him, and I have to go through his medicines. That's it.
All right. Okay, wonderful. So here we have Shreya Chawla, who for the past 4 years was under treatment and with Dr. Vijay Ramanan, and I guess now she does not need any more blood transfusions like she had earlier. So we are here again with another patient who is going through treatment with Dr. Vijay Ramanan at the MVR Daycare Thalassemia Center, and her name is Shanvi. She is 8 years of age. We're going to talk to her, and these are her parents over here. So, Shanvi, how old are you, my darling?
I'm 6'8".
You're 8 years old. Mama says 8 and you say 6. Okay, all right. 8 years of age. And when is it that Shanvi was diagnosed with thalassemia?
She was diagnosed at the age of 3 months.
Okay,
So, like, she was born in Jan 2016,
all right.
and we came to know and on April 16.
Okay, all right. And what did you do after that?
So after that, we visited. Actually, we were in Delhi at that time. So we visited two doctors,
Uh-huh.
and we suggested that HPLC test
All right.
to like know whether she has thalassemia or not, because at that time her HV was around 5 point something.
Okay.
So then she was diagnosed with thalassemia, and we started transfusion from there itself.
And how come you're here now in Pune and you are under Dr. Vijay Ramanan's treatment?
So actually, my job, like I'm in IT, so it's
Okay.
like transferable job.
All right.
Got transferred to Pune, then I came here.
And since when have you been under Dr. Vijay Ramanan's treatment?
Around like it's more than 1 year.
More than 1 year. What do you feel? There's a difference? Is she feeling better?
Yeah, it's no the same thing actually. Transfusion was there, and so we are doing the same thing.
Okay.
And but the atmosphere here and all the like staff is very like they're very helpful, and like we never feel here that like we are in a different place. Like same, like it's even better than Gangaram, I would say.
Oh, wonderful. Yes, you want to say something? Tell us.
No, we feel like it's a home, and everyone is friendly. Sister is friendly, and we get proper transfusion. And so first we came to Pune and we searched everywhere around. And there I heard this. So we some of them have transferred from Pune to Delhi. So they suggested his name. So we went to meet him, and
And now you're under his treatment. I'm sure she's going to get well soon. I mean, I hear a lot of people saying that they have been cured, and I wish you all the best. Now, Shanvi, how are you feeling, my darling?
Good night.
You're feeling good? You want to go to sleep right now? Are you feeling sleepy? Okay. So thank you so much for talking to us, and God bless you, Shanvi. I'm sure very soon you will feel better and you're going to get well. Yes? So this was Shanvi. Thank you, my love. This was Shanvi and her parents giving us their experiences at the MVR Thalassemia Daycare Center.